them. Okay, just inform me that we're being recorded here. But only about 20% of Americans who have hearing loss are actually using hearing aids. And I learned about this uh, about 15 years ago when I was starting up a hearing clinic. But in the intervening time, as I will show you in some of these slides, some new data came out showing that people with hearing loss have up to 500% higher risk of Alzheimer's and dementia including Alzheimer's, as well as up to 300% higher risk of falls with broken bones. Much of this I will give you more data as we go through some of the slides, but this data is not some sort of schlock newspaper ad that was invented by hearing aid manufacturers. This was a result of clinical studies done at Johns Hopkins University and national institutes involving over $400 million in long-term research it's called the Baltimore Aging Study, and found this shocking association between hearing loss and these other health conditions. I've worked my entire life in the healthcare industry, as Marie mentioned in my bio, and I mentioned some of this to my physician friends and to other scientists, and not one of us can think of any other kind of health condition that has that strong of a correlation in any area of our health. Up to 500% is just really an astounding number. So with that as an introduction, let me get into some of the slides. Marie, do you?
So David's running the slides for you. So do you see this, the slide that it's the cover? There you go.
Yes, now I do. Yes.
Got it.
Okay.
Just let me know, Bob, and I will advance the slides when you're ready.
Okay. Well, hearing loss, as the first slide says, it's the third most common health problem in the United States. Next slide, please. But what's really sad, as I said in my introduction, 80% of Americans don't use hearing aids, which means they have up to 500% higher risk of dementia, including Alzheimer's, and up to 300% higher risk of falls with broken bones and clinical depression. Next slide, please. My research over the course of ever since these studies were completed in 2012, I was conducting research as to why people don't get hearing aids. A lot of my research was done when I was giving talks at Rotary clubs and schools and local libraries, and people would raise their hand and say, you know, I don't have hearing aids, but my wife or my husband has told me that I've got hearing loss. And I would say, what are the reasons why you don't? And these were some of the things that I discovered through about 15 years of research. Number one, surprisingly, is that Medicare doesn't cover them. I would have thought that while this might be important, because hearing aids are expensive, hearing aids are considered to be the third largest capital expense we might have in our life after buying a house and buying cars. Hearing aids on average cost around $6,000 for a pair. Now, I could argue that that's one of the best investments you could ever make, because it essentially comes down to about the cost of a Starbucks cappuccino every day. And considering that there's this strong association with Alzheimer's, I would consider hearing aids to be a darn good investment. But the fact that Medicare doesn't cover them influences people. We, most of us really don't look forward to getting hearing aids by any means, unless you've been deaf or hard of hearing from a very early age. When as an adult, we just really don't want to get them. But then when we find out that Medicare doesn't cover them, we dismiss it. We think, well, if Medicare doesn't consider it to be important, then they're really not going to help a whole lot. So, number one reason is Medicare doesn't cover them, so I'm not going to buy them. Number two reason is the stigma effect, which I like to call the stigma effect. It's the fear of looking older. Number three, let's admit it, hearing aids have traditionally had a reputation for very poor performance, and therefore have had a bad reputation too. And like anything else, if things have a bad reputation, then other people don't buy them. And the fourth reason is that the fourth reason why people don't use hearing aids is because most audiologists, in fact, 75 or 80% of audiologists and hearing instrument specialists, such as employed at discount stores, et cetera, the big hearing aid chains, and now all of the advertisements we're seeing on TV are claiming that these hearing aids don't even need to be fitted, that they come out of the box working perfectly. Well, the fact is that that the new hearing aids, over-the-counter hearing aids, really are not truly good hearing aids. But even if you were to go and buy hearing aids from a reputable audiologist or hearing instrument specialist, very few people would even know that there is such a thing as called best practices of audiological care. Well, there are, and they've been published and they've been established and they're highly and widely accepted. But 75% of those audiologists and dealers do not use the best practices of audiological care. I'm not going to get into much of that here this morning unless you've got some specific questions, but it's covered very adequately, I might say, in the book. It shows you how to find audiologists and hearing aid dealers that actually use the best practices. One of the tests, so that you know, is called real ear measurements, and it's described in the book, and it shows you exactly not only how to find those audiologists that are using them, but to ensure that they're actually using those practices on you. So that's the fourth reason why people don't use hearing aids, because they actually don't work to your maximum benefit. Next slide, please. So there's a cost of this, cost associated with it. Dementia care is $20,000 a month. In 2023, it's estimated that Americans in our healthcare system are spending $240 billion on dementia care, and it's projected to grow to $1 trillion by 2030. Now let's look at our overall economic condition in America. We also know that Social Security is expected to run out of money by 2030 as well. Just think of this, that dementia care alone is costing $1 trillion by 2030. So far, those healthcare costs are paid by Medicare, Medicaid, of course, the families and the insurance companies. But at the end of the day, all of us, individual taxpayers, are paying for that dementia care and will do so for a long time. What I'm leading up to here, and I'm thinking that the following slides will help substantiate this, what I'm leading to is that we should be changing Medicare laws. Medicare does not cover hearing aids now. I think it's a travesty. Here it is, the third most prevalent health condition as we grow older. And we now have data showing that not using hearing aids is costing taxpayers all of this amount of money. As my book explains, I'm very confident that we could save billions of dollars simply if Medicare started covering hearing aids and ensured that every hearing aid dealer and audiologist was using the best practices of audiological care. Next slide, please. So, again, how do we modify Alzheimer's risk? The number one way to do that is to address your hearing loss. This has been proven in clinical trials now. Number two is to reduce social isolation. Number three is to control high blood pressure. Number four is to meet aerobic physical activities. 5 is to lower diabetes and obesity. And 6 is to cease cigarette smoking. But again, the best way and most effective and cost-effective way of doing it is to get hearing aids. Next slide, please. The book will show you exactly how to find audiologists who use best practices. It shows you what you can expect from well-performing hearing aids, and also shows you the final chapters of the book give explicit directions on how to find members of Congress and how to advocate for Medicare coverage of hearing loss, and how to advocate for better regulatory oversight of hearing aid dealers. Since I'm speaking to fellow Rotarians here, I would love it, and this is my mission in life now at this advanced age, but it is my mission in life to influence and find the right people to influence members of Congress to change Medicare. I think Rotary could help do that through education. I know it's not an advocacy organization like that, but there are plenty of people that are members of Rotary that are very influential and could do things. It's going to take a ground-up approach to do this. Congress seems to be blind to these things. You might have read about a year ago that Grassley from Iowa, a Republican, and Senator Elizabeth Warren, very left-wing or politically liberal senator, they both sponsored and then the White House supported what was called the Affordable Hearing Aid Initiative. That resulted in what we now see are over-the-counter hearing aids that are inexpensive, and they're frankly not going to do the job. There's no way that they can do the job. They don't have the technology, and they've not been fitted by a professional. And what I'm afraid of is that people are going to try those hearing aids and say they don't work, and then that's just going to further degrade the reputation of hearing aids. I think we're headed for some severe trouble financially as well as socially because of the prevalence of dementia. Next slide, please. The book will also show people how to protect your hearing, the different kinds and types of hearing loss, the different kinds of advanced hearing aid technologies and how much they cost and why you should use them. and then again, how to advocate for change. Next slide, please. Advocating for change is to contact members of Congress and the Alzheimer's and Hearing Loss Associations. The key talking points are it's the right thing to do and that it's going to save hundreds of billions of dollars. Next slide, please. This is kind of a brief primer because so many people, when I'm giving talks, they say, well, Bob, what's this relationship between hearing loss and cognitive decline? And all I can say is we need more research. We definitely need more research, but based on my training in medical school and my long career working in the healthcare industry, I pay attention to such things. The adult brain has 66 billion neurons in the brain. And each neuron has up to 1,000 synapses with other neurons. So multiplying 1,000 times 66 billion means we have 66 trillion neural networks. Neural networks are just a fancy way of saying that they're built-in algorithms that help us to learn and remember and connect with family. And not using those neural networks to their maximum capability leads to plaques, atrophy, dementia, and Alzheimer's. I mention these things because I think that the pharmaceutical companies, they're of course chasing the possibility that a drug will be highly effective in reducing Alzheimer's risk. Well, I think that they're chasing or betting on the wrong horse in the race. It's not going to take a drug. What's required is to keep those neural networks active. And we, of course, know this from our own experience in life, that if we keep our brains active, we stay younger longer. Next slide, please. You can buy the book at Amazon and local bookstores, and then my website is www.hearingsanity.net. With that, that's the end of my presentation, but normally there's lots of questions that come up after this talk. Yes, sir.
David, you're muted. David?
Okay, I just recently bought hearing aids, and I've been looking at hearing aids for several years. And frankly, the whole industry is a scam. Absolute, total scam. The hearing aids I bought, and I've done my research, cost, as you said, $6,000 a pair. I got them for $1,500. Now, how did I do that? I joined a clinical trial. So there was some kind of discount, but I guarantee there was not a 75% discount. And I have been to multiple audiologists and had hearing tests done over the years, and they immediately want to jump to selling you expensive hearing aids. And in fact, when I got these hearing aids, I was told by a very good audiologist at Duke Hospital that I was minimally hard of hearing. And I could make my own decision, did I want hearing aids or not? But the industry's pushing it. Why is it such a scam?
Well, first of all, congratulations on making a decision to get some hearing aids. Second, I don't know how congratulations on getting them at a good price. I would heartily disagree with you that the whole industry is a scam. I would heartily disagree with you. Yes, many of them are a scam, but as the book explains, there's about 80% of audiologists that use the best practices of their profession. And the data cannot be more clear that hearing aids improve your quality of life and reduce your risk of dementia as well. the thing is, the industry has evolved in an really odd way. Here I've worked in every segment of the healthcare industry that you can, and audiology and hearing aids have evolved in an entirely different way. Just think, it was less than 100 years ago that, or about 100 years ago, that the first hearing aids were invented. And essentially, they're just simple amplification devices. And all that was important was making sure that people could hear something so that they could function in life. Those hearing aids were required you to carry around the battery in a large suitcase, and they were still very difficult to use, but they've evolved over the years to where they can be miniaturized and computerized so that they can do marvelous things. But the FDA did not keep up with that. They simply were looking at hearing aids from a safety perspective and not from an effectiveness or efficacy, as the way without going too deep into the woods, the way you get approval of an FDA drug or most medical devices is you have to prove both the efficacy and the safety. When it came to hearing aids, all they were interested, and they still are only interested in the safety issues. Not until recently have these clinical studies been done to show that hearing aids are actually efficacious. So coming back to your point, I heartily disagree that the entire industry is a scam. You can find good audiologists, very conscientious audiologists, and I would encourage you to do so.
So I've been listening very carefully to the words and phrases you use. I will modify my statement slightly. The majority of the industry is a scam. Okay. You said you can find. Yes, it's extremely difficult. And by the way, I totally agree with you that the devices that you can buy on the internet, they are not hearing aids. They are called assistive hearing devices. And there's a light years difference between those devices and what I have. And mine are tuned. It was amazing to watch how they tune them. I got the profile of my hearing loss, and they twiddled the knobs until my hearing aids brought all of my deficiencies up to the proper level. And I watched it in real time happening. So please, everybody, don't buy those devices on the internet. They're not hearing aids.
That's the best thing you could say right there.
Yeah. By the way, Bob, I wanted to throw out a suggestion. You mentioned advocacy. Have you heard of a Rotary Fellowship called the Rotary Fellowship for Hearing?
No, I don't know about that. No.
I can send you information. It's, I don't know, there's 50, 100 Rotary Fellowships around the world. They're independent of, but associated with Rotary International. There is one for hearing, and it's principally a group of audiologists who are interested in improving hearing, I guess, around the world.
I'm really glad to hear about it, and I'd like to get more information from you. I do know that Rotary has we have it at our club, those blue buckets that are passed around.
Right.
What is it called? CART.
Coins for Alzheimer Research.
That's right. That's right. I would love it for Rotary to pick up on this mission. I'm an author. I think I've got the credentials to talk, and I've got the data to support me, but I'm not a very influential person. I'm not going to be selling that many books, I can assure you. But what I would love is somehow that becomes my calling card, and that if I can surround myself with the right influential people, I'm thinking maybe the Alzheimer's associations would be effective co-partners with me. Actually, I'd let them lead me into the offices so that I could talk. They are far more influential than I am, but we need we need those kind of efforts. So I appreciate your suggestions along those lines. And if anyone's got any more suggestions for how we could do this, I'm all in. Just count on me.
I'll be happy to send you the link to their website.
Okay,
Yeah, Joan
good.
has her hands up, and David, could you stop share so we can see people better?
Hi, thank you. Can you hear me?
Yes.
Yes.
Because I keep getting the mute was going on. So first of all, thank you, Dr. Keefer. I'm in healthcare myself, and I was just looking at it's over $20 billion that has been spent on falls for injury from falls. So you do have a valid point about how hearing contributes to fall injury, and if the government doesn't realize that hearing is an issue, should be addressed, Medicare doesn't cover it, they would probably save billions of dollars caring for patients that have fall injury, because it can be very severe and it can lead to death. Also, I was recommended that, what about the AARP, that organization of elderly, that could be lobbied also to help advocate to make sure they could cover hearing aids for people. So that's some of the areas. Next question is, would this presentation calls for a CEU for healthcare professionals?
I'm not an expert on such things, but I would say that it is needed. Obviously, I know a lot of physicians. I've known them ever since medical school. And in our private moments and over coffee and conversations, I'm not shy about asking them when they find out that I've got this interest. I say, by the way, doc, do you recall ever getting any education about hearing aids or hearing loss in medical school? The general answer is that they never received any information about this, unless it had to do with infections of the ear. Then, of course, then they were educated about the use of antibiotics, but they have precious little information about hearing loss and hearing aids. They're not required to do a sophisticated or reasonable hearing test during your annual physical too. So I'm all in when it comes to educating physicians. That it could go a long way. It could go a long way.
So I would be asking Marie for your contact, and then I could contact you offline to see if you can do a presentation to our group of healthcare. We're CEU providers by you giving some objectives, and I think this could go towards education for healthcare.
I would love that. By the way, regarding your second point about the AARP, AARP, they actually have some agreements now. I think if you're a member of the AARP, you can get hearing aids at some sort of a discount. I'm a little bit unclear about what the relationship there is, but they do endorse. Oh, I know what they do. They work with certain insurance companies, and they say that if you're a member of the AARP, you can, through this insurance company, get hearing aids at a reduced amount. Well, we have experience with those particular hearing aids that they are endorsing, that those insurance companies are endorsing. Yes, they pick certain brands, endorse them, but they don't enforce the audiologists and hearing instrument specialists to use the best practices of audiological care. Let me say it, if I didn't say it earlier, more important than the hearing aids is the way that they are fitted and fine-tuned to your exact hearing needs.
Okay. So thank you for your response, Dr. Keefer.
Sure.
Great topic.
And I'll get you the contact information.
Thank you.
Your
Any
name
other
was
questions?
Marie?
I'm Marie. The person with the question is Joan Howard.
Joan Howard, thank you.
Any other questions?
Well, keep thinking about it, all of you. For those of you who might know him, Bob Malone, Robert Malone at the Kerry McGregor Rotary Club is a big fan of this initiative. He's always coming up with ideas on how we might push this forward. But if you know others that are outspoken and in positions where they've got ideas and energy to put into this, count on me to help out, please.